Well, for more, we're now joined by Nomatter Ndebele. She's a communications officer at Public Interest Law Centre, Section 27. Of course, Section 27 involved last year trying to prevent those transfers of the patients in the first place. Just give me the history first. What happened there?
All right, so actually we got involved in 2015 when we heard from a few family members who said that they had been trying to stop the government from getting their family members removed from Life Esidimeni because the government had said that they were closing down and transferring them to NGOs. And they had already had the sense that something was wrong because there was no consultation, and so they came to us and asked us to intervene. And so what initially happened is that we got into a settlement agreement with the department where they decided that they weren't going to move any of the patients until they had proper consultation with the families, and we said that they had to make sure that, you know, if they were going to be moved from Life Esidimeni, whatever facilities they were going into had to ensure that they were providing better care or the same care.
So the department agreed to that?
Yes,
then
initially.
What happened?
And then they did not do what they said they would, and they started to move patients without consultation, and, you know, people weren't told where their family members were going to. And so we got involved again, this time with litigation, but the court threw our case out.
Why?
They said that the MEC was justified. They said that, you know, because she initially had said that the facilities that she was moving people to were actually, you know, absolutely of the highest standard and they would be able to take care of people, but actually she had lied and that hadn't happened.
So the courts, I guess, didn't have that information about the reality of the NGOs. Murder charges were laid today. Are the families themselves thinking now of legal action, class action? What is the talk amongst those families, as far as you know?
At the moment, everyone is still studying the report very carefully, and of course we are consulting with the families because we are representing a lot of them. So there isn't one general idea of what they want. Everybody kind of has a different idea of what it is that they want, and we're still trying to figure that out specifically.
Is there any leaning towards one option?
There's definitely going to be legal action, but we just aren't able to say what that will be at the moment.
Right now, there's a whole lot of other patients possibly still in those NGOs. Does that concern you?
I think that's one of the biggest problems. It is absolutely shocking that 94 people died, but we need to remember that there's still so many other people that are in these facilities and not being well looked after. And the biggest thing is that when we move forward from here, we need to ensure that the mental health care in South Africa is reformed to prevent this from ever happening again, so that there are no other deaths. But at the moment, it could happen. People still don't know where their family members are. We don't know, you know, what's happening in these facilities, and so there is a high chance that more people
Is Section 27 in touch with people who really don't know where family members are?
There are a few people. There's a family committee, and, you know, people come on there and they say, I'm still looking for my family member and I don't know where the person is. But mainly we're in touch with the people who have lost their family members and that we're representing.
All right. Do you believe that the death toll could still rise?
Definitely.
Like David Makhura suggested?
Absolutely, because like I said, you know, there's people in hospitals also, there's people that are not accounted for, so they're probably sitting in a facility somewhere, nobody knows where you come from, nobody knows who your family member is, and there's going to be a lot of deaths still if people are not accurately taken care of. In
a piece we ran earlier, new claims that patients were naked, not even dressed in winter. What do you know about the conditions? Is Section 27 looking into that to just categorize what happened here?
So that has been one of the most important things, because it has been family members who've come to approach us to say, you know, I went to go and see my brother at this place and they looked absolutely terrible, in a shocking state. And you'll see in the report, one of the family members, Maria Collitz, said that her husband had been so thin, and the last time she saw him, he literally was wearing oversized pants, and they had made a makeshift belt for him with shoelaces. So people are in a position where they're not fed, and, you know, in the report these places are described as concentration camps, so you can imagine the dehydration, and a lot of people actually died from dehydration and starvation, so you can imagine that these facilities are absolutely shocking.
You've asked for inquests into all of the deaths. Who are you dealing with among authorities now?
So initially, one of our clients, Christine Ngumalo, had asked for an inquest into the death of her sister, and then we subsequently asked for an inquest into all of the deaths. We didn't hear anything else from the police commissioner in Tshwane. All we got was a confirmation that they were going to investigate 13 of the deaths, but we haven't heard anything else from them, and we're hoping that this report is going to spur them on to do more.
Okay, so that'll provide more clarity, because we at least get a cause of death, because it's still pretty uncertain in some of the cases, although we're getting a picture of just fatal, negligent circumstances, I guess.
Definitely. I mean, because nobody, wants to take responsibility, and, the NGOs were unlicensed, people were just saying, it's natural causes, because they couldn't provide an explanation. How do you move someone from a mental facility where they'd been living there for years and they were absolutely fine, and suddenly in 4 months, they're in a state that you can't even imagine and they've died?
The MEC has resigned. As far as we know, other officials implicated. I think you guys have been following the 2 doctors implicated. There are even suggestions of fraud, of changing licenses. So as far as you know, are they still in their jobs? Is that a concern? Because that's an immediate concern, I guess.
Yeah. So, the Ombudsman said that there had to be disciplinary action against these people. As far as we know, they are still in their jobs, and it's important that everybody goes under the right accountability structures, because, 94 deaths is not a joke. And also particularly because these people were warned beforehand and they knew what was going to happen. I mean, you ask yourself, if this had not come out, were they just going to kill 3,000 people and hope that they get away with it, And so it is very, very important that disciplinary action is taken against all people.
There's 45 days, I think.
Yes.
We're hearing rumblings about NGOs across the country, and another MEC defined, it was reported yesterday. Do you have a sense of the national picture with these institutions?
So basically, we have a huge country, and we have a huge problem rather, and it's not just in South Africa, because like you've said, we're hearing social development trying to move people out despite everything that's happened with Life Esidimeni. We've heard rumors of the same thing happening in Limpopo and KZN, and it just goes to show that there's a lot of work to be done around the mental health care system in South Africa to make sure that we don't see this again.
Section 27 calling for people to be held accountable to the fullest extent of the law. What does that mean?
We're looking to hold people accountable in every regard, politically, professionally, with civil lawsuits, in any way that they can, because it is important. People can't go around thinking that people's lives are inconsequential. I mean, one death is just way too many, and people cannot just be so relaxed about this.